Ladies and gentlemen, sexually transmitted diseases are skyrocketing in America. Now, the only time that it actually went down was the beginning of the lockdown in 2020. U.S. sexually transmitted infections surged to record high in 2020. After a brief dropping in the early months of 2020, the rates of sexually transmitted diseases have resurged beyond 2019 levels to finish the year at a record high, according to new data from the Center for Disease Control and Prevention. Researchers with the CDC said the report, 2020 Sexually Transmitted Disease Surveillance, shows how the pandemic disrupted in person health care and diverted scarce public health care resources away from STIs, which had been on the rise for years, ultimately diverting resources to the pandemic. And it caused young people, racial minorities, and here we go. It's amazing. Everybody gets STDs according to them, except for them. It's the same thing, nothing different. So the new data provides the clearest picture yet of the impact of STIs. Dr. Jonathan Merman, director of the CDC's National Center for HIV, Viral Hepatitis, STD, and Tuberculosis Prevention. Honestly, there's just must be, they're saying this must be done. So the new report covers 2020, the first year of the pandemic, and the time defined by lockdown, social distancing, and fear. The new report covers the rate of gonorrhea, chlamydia, and syphilis. Early in 2020, it appears that social distancing might have reduced the STIs. However, by the end of the year, the infections surged past 2019 levels. In just one example, rates of gonorrhea jumped 10% by the end of the year. Those increased rates were driven by a lack of in person appointments, delayed health screenings, lapse in health insurance for people who lost their jobs, and crumbling healthcare. That diverted contact tracers and testing supplies, all going towards the pandemic. In 2020, reported cases of gonorrhea jumped 10%, and primary and secondary syphilis in stages 2 of the disease with different symptoms, that jumped 7%. Especially worrying was the rate of congenital syphilis or syphilis passed from mother to newborn, which was at 15% in 2019. It jumped up 235%. Mm-mm-mm. And this is all in 2020, y'all. The rates of chlamydia declined 13% in 2020, but researchers said the decline was not something to celebrate. Rather, chlamydia is typically detected in a person's screenings, such as pap smears. Because people put off these visits in 2020, cases probably went undiagnosed. What's more is groups that suffered disproportionately from new infections, such as um, those, and they're always talking about disadvantaged people. We know who they're talking about. The STIs also especially affected the young and poor. So the biggest infections were seen between the ages of 15 and 24. For decades, the US spent more on healthcare than any other country, yet has the worst healthcare outcomes than many other developed nations. Then why are we paying you all this money for healthcare? And how is it that the United States and these liars, we invented medicine? Yeah, well, how come y'all are last in everything? You're last in the pandemic, you're last in medical outcomes. Why are you last in everything, but you're the inventors of everything? Please explain. But we're paying all this outrageous money for healthcare in America and the outcomes. This means when they give you treatment, give you surgery, or treat you with medication, the people here have the worst outcomes from the treatments. That says a lot about America. Yeah, high IQ. So anyway, we America got the worst outcomes out of any other developed nation. Y'all remember that the next time they're boasting about they're the inventors of everything. Okay, y'all remember that. Such high rates of STI among people with fewer resources are a reflection of the nation's failure to provide sufficient health care for everyone who needs it. Although the 2020 data is grim, researchers say that there are bright spots. For example, testing capacity and contact tracing, staffing have stabilized since 2020. And they're always talking about some pre-pandemic levels. I never believe you. I just don't. I never believe y'all when you say that. The federal government has also released the first national 5-year plan to combat STIs, and it has invested $200 million to build public health capacity. The hope, said researchers, was to avoid disrupting services for diseases such as STIs should another emergency occur. So, America, the overpriced medical system and terrible outcomes in comparison to the rest of the world. And I'm not surprised that this has happened. I think a lot of these people did have problems prior to the lockdown. And like they said, many of them just went untreated for so long. And then I also believe a lot of times, when spring came and they reopened everything, I think a lot of these people went buck wild and just everything just became active again. And these sexually transmitted diseases just went through the roof. So I tell you what, there's several articles out here, and America, as usual, is doing worse than everybody else when it comes down to treating these things. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.